Hello, good afternoon. My name is Dr. Trude Ofundu, and this is exactly the event we've been waiting for. So thank you so much and welcome to our month's first edition of subspecialty Open Masterclass. So today we're talking about love. We're talking about the heart. We're talking about Valentine. So many people are getting ready for Monday. You know, you're going to celebrate Valentine with your loved ones. You're going to buy flowers. You're going to receive gifts. But we are going to talk about the foundation of everything. You see, when your heart is in a good place, you'll be in a good place yourself. So today we have a special privilege of having my own brother, my younger brother, in the person of Dr. Obiora Maludum. Obiora is someone that took time to study the heart. Obiora spent a lot of years studying the heart, the four chambers of the heart. Now, after he finished studying the heart, he went further to study a special part of, the heart, which is preventing people from dying. Now, what we're going to talk today, it's not about you getting to the point of meeting Obiora. Majority of our community are women and men that want to start their family. Obiora is going to help us to understand the function of the heart, how we can keep our heart healthy, the connection between our heart and our fertility. What's the big deal about telling you about your heart, about your body weight, about your BMI before you start your family? How can we prevent our members from meeting Obiora? Because we don't want you to meet Obiora. The only people we want to meet Obiora are the people that have a lot of money, people that are probably in their 90s, in their 100s, and they've completed their life, and we want to add more years to them. So we want them to live up to 100 years. Those are the people we want to see Obiora. So Obiora is an interventional cardiologist. A cardiologist is a special doctor that only concentrates in studying the heart and the vessels. So the heart has some vessels that it's used to pump blood to the whole part of the body. So it's a special privilege to welcome my younger brother, my friend. Is not, sometimes you have a brother, but you guys might not be friends. But Obiora is my brother and my friend, and he's a friend of my community. So it's a big privilege to have this amazing, one of the best professionals in the heart health in our midst today. Dr. Obi, thank you and welcome to my community. Please introduce yourself.
Thank you very much. My name is Obiora Maludum, and let me start by saying that Trude is my senior brother, and I appreciate all the good work you've been doing over the years. You have been there for a lot of people who are looking for the fruit of the womb, and you have helped a lot of people. And we pray that may God continue to bless you and bless all your members and bless everybody who's looking for the fruit of the womb. And we pray that this year somebody somewhere is going to be blessed with your heart desire, and you will no longer be infertile. But through some of the things we're going to talk about today, you're going to find some help, things that will help you to live a healthy life, to get you pregnant, and also even when you're pregnant, to remain healthy throughout the pregnancy so that both you and the baby will be alive and well. So like my brother said, I did my medical school back home in Nigeria, came to the US to do residency, and did residency and did my fellowship in cardiology. And I went back also to do interventional cardiology. Basically, what my work entails is usually to see people who, like he said, at the end of the spectrum, who maybe are almost dying, that we need to either one way or the other put a stent in the heart or do something to revive them and all that. So, but the main part of this discussion today is going to be how to prevent you from getting to meet people like me. Because when we were growing up, there's a saying that prevention is better than cure. And that is the truth for any time, any day. So we want to prevent you from getting to that level before you get to me. Thank you very much for having me today.
Yeah, thank you, Obi. And we're going to get started because we have a lot of things to talk about. You see, where I'm from, we are from Anambra or Rifite, especially. And there's this saying about, seeing an eagle. So we don't see an eagle every day. So when you see an eagle, you make sure you take a deep, good look. So we're going to milk Obiora today. We're going to collect all his knowledge so that by tomorrow, when he goes back to his practice, they'll be wondering what happened to him. So we're going to start. So in celebration of the American Heart Health in our group, we invited you to help us to understand what you do. Like you rightly mentioned, you specialize in people that actually have diagnosed heart disease, problem, disorder. You deal specifically with putting stents or what we call catheter into the heart. And you've been trained for this. You've been doing this all your life. Now, how do we connect the dots with what you do? So who is a cardiologist to start with? Please, can you help us understand what a cardiologist does and who a cardiologist is? Please go ahead.
Thank you very much. So a cardiologist is a specialist doctor who deals with the heart in its entirety. These days, we actually call it a cardiovascular medicine, where we deal with both the heart and also the blood vessel that supply every part of the body. And so for you to be a cardiologist, you have to first of all go to medical school and become a doctor. Once you do that, then you do what we call a residency program, where you go through all the internal medicine residency program. And after you've done that, then you can decide this is what you want to do. You want to specialize in the heart and all the blood vessels supplying the body. Then you now go ahead and do the fellowship here in America. Depending on where you are in different parts of the world, they have a different pathway. Then once you do that, for me, like I said, once I finished doing that, I had to do even advanced fellowship in interventional cardiology. So in summary, a cardiologist is a specialized doctor that deals with the heart.
Okay, thank you so much, Obi. Now, what's the difference between a cardiologist and an interventional cardiologist?
Good. So an interventional cardiologist, from the name, means you are now a cardiologist plus addition of doing intervention in some patients who need it. Like I have a heart model here, so I'm going to show you. So this is a heart model, okay? And you can see that this heart model, there's some blood vessel here that supply the muscles of the heart, okay? So one of the things we do as cardiologists is that the blood vessel is magnified in this picture here. You can see this image here. So the blood vessel is like a pipe. The blood vessel supplying the heart is like a pipe, okay? So usually the pipe should be without anything inside it. It should be free so that blood can flow easily to supply the muscles of the heart. But when you come to this part, you see this yellow part. So these are plaques, like cholesterol, that deposit inside, making it to be narrowed, that blood vessel does not flow so easily. And when this happens, at some point, it may keep closing until it's completely closed. And that could lead you to what we call a massive heart attack, where people die. You know, sometimes we hear that people die while either they are jogging or sleeping or doing whatever, and we think it's village people. It may not actually be village people.
Correct.
So it means that it's mostly that this part of the blood of the blood vessel is completely blocked, that the heart muscle is not able to get blood supply. So what we basically do is that we put a wire through this place and then open up this blockage, okay, with a balloon, and then put a metal, what we call a stent, inside there to maintain that normal blood flow in the blood vessel that supplies the heart. And that's how we help to save a lot of people. So this is what an interventional cardiologist does, in addition to just being a general cardiologist, where you also do about the preventative aspect of cardiology and also the treatment part of the cardiology. You now do extra intervention. We can also replace some of the valves. So if you look at the heart, inside of the heart, so there are 4 chambers of the heart, okay? There's upper chamber in the right side, upper chamber in the lower chamber in the right side, and then upper chamber in the left and lower chamber in the left. So these are all separated by what we call valves, okay? So blood flow from one area of the heart to the other. So sometimes either the valve will be too narrow or the valve will not be closing very well, which we call a leaky valve. We can also intervene on those places and put a new valve there. So that's part of what an interventional cardiologist does.
Okay. Thank you so much, Obi. You know, predominantly, my community are pretty much baseline in their knowledge of the heart. Now, I want to use this opportunity to also acknowledge my COO and my moderator. So please, if you have any question for Obiora, don't be in a hurry. We are going to get all the feedback. So please focus on Kenneth, my COO, and Chinyere. Make sure you follow through. And if you need to get across to Obiora or me for anything, we're going to give you that opportunity. But right now, let's go to the rudimentary. Now, Obi, you showed us the heart. Now, I remember when we were in our elementary biology, they taught us about the 4 chambers. So in a layman's, kind of language, can you tell us the 4 chambers of the heart and what principally, how the heart functions to distribute blood to the body and bring it back to the body? And when any of those things have problems, which aspects of the heart can lead to problems? Please go ahead. Use that model to teach us, please.
Good. So I'm going to try to be as simplistic as possible and try to use less of a medical terminologies here so that I'll be able to pass my message across to everybody. So like you rightly said, the heart has 4 chambers. So the chambers on the right side, so these are chambers, the one at the upper end, we call it the right atrium, and the one here, right ventricle. So they're on the right side. So what they do, so the blood comes from the vein in your body towards the upper chamber in the right side. So from there, there's a valve, okay, that helps to direct the blood into the lower chamber of the right side, okay? So if the valve is functioning well, blood will go through in a normal way. But if the valve is not functioning well, either that the valve is too narrow, preventing the blood from going down, and then the blood is going to pull back and start causing some swelling in your legs. Like some people you see having some swelling in the legs, it also can be due to that. So from the lower chamber of the one in the right side, the blood now goes through the lungs and then come back into the upper chamber of the left side. So from there also, there's another valve here that connects that upper chamber on the left to the lower chamber on the left, okay? And then there's a valve there, which is also very, very important. So if there's also some problem there, either that the valve is leaking, meaning that the blood does not go from up to down, it goes backwards. So when it does go backwards, or when the valve is too narrow that the blood does not flow, everything also moves backward. And when they move backward, they go to the lungs. When they go to the lungs, then fluid will start developing in your lungs. And that is why you start having some trouble breathing. You start not being able to sleep well at night. Some of them will have to now need a lot of pillows. You see some people using 3-4 pillows because they can't sleep flat. They will not be able to sleep, and they will be waking up at night gasping for breath. So these are what the heart does. Then the most important aspect of this heart chamber is the left ventricle, which is the one at the left lower end, okay? Because that is where most of the muscle mass is. And that part now pumps the blood through the major blood vessel here called the aorta. And from there, the blood now pumps oxygenated blood that comes from the lungs, pumps through there to every other part of your body, to the brain, to the even some part of the heart, to your womb, to the ovary, to the testicles and all that. Every part of the body, they get their blood through the pumping of the left side of the heart, the ventricle, the left ventricle. So what we are talking about this is to make sure you keep every part of this heart healthy so that blood will be pumped in a normal and in a nice way to every part of your body, and they will get all the nutrients that the part of that body needs to function very well. So the heart is like the generator in a house. If you don't have a generator, a lot of things cannot be powered in your house. You know, you're not going to be able to watch your television. You're not going to be able to put on your tap to bathe or do any other thing. So it's like the generator, the things that connect almost everything in the heart. That is why the heart is very important, and that's why we take it very seriously. And like you rightly said, this month is the heart month. We try to educate people about how to live a healthy lifestyle. And like we said, my duty is to make sure you don't get to a level where I have to intervene.
I mean, correct.
So if you do these simple things, and these simple things don't cost a lot of money, by the time you get to see me, you're going to spend a lot of money.
And you might not have a chance to survive.
You might not also have a chance to survive. So that's why we're doing all these things, to make sure that you get yourself to a level where you don't get to a level where I have to intervene on your heart.
Correct. So thank you so much, Obi, for that explanation. We're still going to go back to that heart model. Now, why do we have different colors in that heart? So what is the significance of the blue, the red, and I also saw some yellow color. So please, can you tell us the implication of the blue, the red, and the yellow part? Please go ahead.
So for those who know a lot about the blood, when you have oxygen inside the blood, it makes it more red. When you have less oxygen, it makes it a little bluish. So once the blood is coming from different parts of your body to your heart, they don't have a lot of oxygen anymore because they've used that oxygen to supply different parts of your body. So that's why you have all this blue color here. Okay. Then from this right side of the heart, the blood is now pumping to the lungs. In the lungs, when you're taking a deep breath or when you're taking a breath, you have oxygen that goes in and exchange and goes into the bloodstream. Once they get to the bloodstream, they become more reddish. And that is why you see this red color here.
Correct.
Okay. And then you see there's some yellow stuff here, meaning that the heart itself, on the muscle and the sac containing the heart itself, you can have some fat tissues there. Okay. So, and we're going to talk about how to maintain a healthy cholesterol and fat, because the more you eat them, then the more they're going to deposit both here and inside the vessel. Like I told you, I showed you this prototype where you have a lot of clog inside this pipe, which is the blood vessel. So these ones are also yellow. So anywhere you see this yellow, is just showing you the plaque, which is made of mostly cholesterol.
Correct. Thank you so much, Doc, for that, because I needed us to understand the difference between the blue and the red. So the blue means the vessel that is bringing a deprived blood, which oxygen has been stripped away. But the ones red, so red represents oxygen, the oxygen capacity in the blood, which is the hemoglobin. So you need to understand this. Now, Doc, you mentioned something about village people and jazz and sudden death. Do we have any particular age gap that this heart problem is limited to? Do we have any particular age gap that will have heart failure, congestive heart condition, or heart attack, and all that? So, please educate us more about this village people syndrome or jazz or poison in regards to what we know reality-wise from your experience. Please go ahead.
So no age is actually immune to having any kind of heart disease, though we know that the older you go, the more risk of developing heart disease that you're going to have. But no, I've seen a 30-year-old who had a heart attack that I had to intervene on to save the person's life. So no age is immune to having that. But like I said, the older you get, the more risk of developing it. And from where we come from, we always blame the village people. And you see people who do not take care of their life very well. They live unhealthy lifestyle. And anything happens, instead of them to seek medical help or ask anybody that knows very well, they just blame it on village people and sometimes casting and binding and all that. I'm not saying there's no place of prayer, but God has given us the wisdom as doctors to help. So if you come to us, we can also help with also praying for you, and also doing the right thing.
We prayed before we started. We are very prayerful people. We were brought up praying. The reason where we are today is because of prayers we knew and we learned from our parents. So we believe in praying. Like in my group, Obi, our motto is pray, play, practice. So we pray a lot. We are product of prayers, but we also play and practice.
Very important.
But I want you to understand that if you have to contact Obiora for anything, then it's bad. We don't want you to contact Obiora. So we want to make sure that we curb that opportunity of you seeing Obiora, because at the point you're seeing Obiora, you're going to spend a lot of money. You're not going to have good quality of life. Your people are going to be worried. You're going to be worried, and you might end up being a vegetable. So be careful. Why we are doing this in February is to make sure that when you go out there on Monday, you are in good health. When you want to eat your food, you eat good food, you avoid stress, and you make sure you're careful. Obi, I'm going to quickly throw this question on the screen from my COO. The phenomenon of feeling you are suffocating or drowning and not being able to sleep due to fluid is popularly called evil attack. Please, can you explain to us in medical terminology what this client might be going through? Please go ahead.
All right. So when you feel that feeling of suffocating or drowning and not able to sleep, there are a lot of things that could be going on, okay? But one of the major part is part of what I explained, where your heart is either not pumping very well because the muscles are very weak, or like I said, the valves connecting those chambers are not working very well. So the blood is going to pull back into the lungs, and then you're going to have a lot of fluid there. And that is why you're suffocating. We call it like drowning in your own fluid.
Fluid, correct.
You know, so it doesn't mean that it's village people or evil attack in Nigeria. It could be a sign of heart disease.
Correct.
It could also be a sign of primary lung disease, where there's a damage one way or the other to the lungs. So these are the two major things that could lead you to feeling suffocating or drowning.
Correct. Thank you, Doc. Now, in our community, predominantly women, and majority of them want to have babies. What is your advice as a cardiovascular interventionist in regards to what they need to do to make sure they have good outcome, to make sure, I remember when you were talking about blood distribution, blood needs to get to the ovaries.
Yes.
We need blood to get to the whole womb, the ovaries. So what will happen if a woman has a problem with the heart? How is it going to affect the female reproductive system? How is it going to affect the womb, the cervix, the vagina, the tubes, and the ovaries? What will be the impediment, which might not be directly, but indirectly in regards to fertility? Why do we need to consult a cardiologist for women that might want to become pregnant and for women that have infertility problems? Please go ahead.
Good. So part of the reason why you need to consult a cardiologist, especially for people who have a problem with infertility, is like we said, the heart is like the generator of the house, okay? So if the heart or anything related to the blood vessels supplying different parts of the body is not working, you will not be able to have, like the ovary will not get enough supply to be able to produce the eggs that it should produce normally. The womb itself also will not be able to get enough blood supply for healthy implantation of the egg when it happens. Then also, you have some hormones in the body that get blood supply to be able to produce those hormones, like the sex hormones and all that. Mm-hmm. So if your heart is not pumping well, or there's clog in the blood vessels supplying those parts of the body, then they won't be able to produce those hormones. And remember, you need those hormones to be able to conceive. So these are the things that you have to look at. And there are simple ways to help your heart to be healthy if you're looking for a pregnancy. And one of them is to remain active, okay? We'll always talk about being active, physically active. And according to the American Heart Association, the minimum hours of physical activity you should have for just normal physical activity is 150 hours per week. So that translates to about 30 hours in a day for 5 days at least. Okay. So
3 hours.
What's that?
You say 30 hours in a day.
Yeah, in a day. Sorry, okay. 30 minutes. Sorry, did I say hours?
Right.
30 minutes. Yeah.
30 minutes.
sorry. 30 minutes. 30 minutes. Sorry. So 150 minutes hours in a week, which is 30 minutes in a day. Okay. So that's what you need basically. Then also you should make sure you check your blood pressure as regularly as possible, because there are a lot of conditions that can make your blood pressure to be high that can also affect you getting pregnant. Things like a thyroid disease. You know, if you have a thyroid disease, your blood pressure can fluctuate, can go high if it's hyperthyroid, the thyroid is functioning too high. So And if you have that kind of abnormality with your thyroid, it can also prevent you from getting pregnant. So it's also good you check your blood pressure, make sure the blood pressure is in normal range. And in 2017, the American Heart Association and the other organization came up with a new number for normal blood pressure. So normal blood pressure is now defined as a blood pressure that is less than the top number, which we call the systolic blood pressure, less than 120 millimeter mercury. And the lower number should be less than 80 millimeter mercury. So that is normal blood pressure target for anybody who is seeking to get pregnant. Okay. Then when it passes that 120, between that 120 to 130, the upper number is what we call pre-hypertension, meaning that you are at risk of developing hypertension. So
you're warming up.
What's that?
You are warming up.
You are warming up. Yes, you're warming up. And that is where you should catch it. You know, they always say catch them young.
Yeah.
So that is where you should actually start doing things that will prevent you from it to go higher. Like we talk about physical activity. The other thing is losing weight. BMI is a very, very risk factor for infertility. If you're very big, you are less likely to get pregnant. It doesn't mean you cannot, but you are reducing your chance of getting pregnant. So you have to make sure you lose weight as much as you can. And then smoking is a no-no for anybody who is planning to get pregnant. Don't ever try it. One is that it's going to make all this pipe to be clogged with smoke, right? It's also going to affect your lungs. And that means that when you get pregnant, you're going to have more trouble during pregnancy. It's also going to affect your baby. So you find out that there's no advantage of smoking. In fact, I tell people, if you're looking for pregnancy, no smoking. Both for you and for your husband, no smoking. So we talked about that. Also, the other thing you're going to watch out for is your diet.
Correct.
You have to make sure you eat a very healthy diet. Eat more of fruits, vegetables, and then eat less of red meats, and then less of high carbohydrates, and more of protein. So these are the things, once you're active and once you check your blood pressure, make sure your blood pressure is within range, and see your doctor, make sure if it's high, they start you on the right medication, and also lose weight, and also watch your diet. So, and no smoking. So these are things you can do to help yourself. And you find out that these things are not very expensive, because by the time you get to a point where you start having difficult problem, don't blame village people.
Okay, thank you, Doc. So I've been wondering. I know you're my younger brother. People might not know that, but lately I noticed you've been looking younger than younger. So is it this combination? Is this the method you've been using? Look at your smile. Well, the last time you guys came to Orlando and you came to Tampa, your complexion you're still fair, but is the secret you gave us now, is it the secret behind your youthful appearance, your healthy appearance? Because like I tell my people, I can't show up unhealthy and I'm telling you to be healthy.
Yeah.
I can't show up smoking or doing the wrong things and I'm telling you to be healthy. So the reason why I'm bringing in this humor is the fact that Obiora lives by example. He goes to gym. He tries as much as possible to practice. You can see I'm drinking my water. It's weekend. I would have opted to go and drink alcohol or go do stuff or stay back and be watching. Obiora is a Chelsea fan. I'm an Arsenal fan. So we could have stayed in one place watching our game and doing all that. So it's all about balance. You can still watch your game, but you need to get up because Obi, we've been told that sitting is the new smoking. So sitting without moving yourself is even worse than smoking, because when you have a sedentary life, there are so many things that can affect your ability to start your family. And the aim of me and Obiora today is to help you to become a mother and a father in 2022. So please, leave the village people alone. If everything we've heard about the village people is actually, actual, then nobody will be standing, because they can send their missiles from the internet and everybody will just die and nobody will be in the world.
Have you wondered how is it that the white people don't have village people?
Correct. I don't know. Maybe our own village people is different, because we still want to be like them. They are still more powerful. So I don't know. Maybe these village people just has a limit. Maybe if they come to Bermuda Triangle, it's no longer effective. But the point I'm making is, my people, everything is in our hands. Everything Obiora mentioned is not expensive. You can eat good food, you can exercise, you can drink your water, you can avoid this, you can sleep. Obi, I noticed that my population, they don't sleep.
Oh,
and when
that
you
is
don't
that is
sleep,
that is
you
another
build
point I'm
up
going to
this
talk about.
factor. Correct.
Yeah. So you brought out a good point. If you don't mind my interrupting you. So
Correct.
what people don't know is that the major part of your body is water. Okay. And you have to keep replenishing that water. So water is very, very important. In fact, my wife knows that I don't drink anything except water most times. You know, I'm not saying that once in a while, you know, you don't give yourself a treat, but the majority, a lifestyle of mine is water, water, water. In fact, somebody actually said that this is the secret that most doctors have not told people to good life is water.
Correct.
All right. So water is very, very important because major part of your body is water. So you need to keep replenishing that by drinking as much as you can.
Correct.
All right.
Correct.
So then the other thing is the sleep. Sleep is vital in so many ways, and I'm going to tell you why. So the recommendation is that you should sleep at least 7 hours every day, at least. And it's not just sleeping, it's short eye sleep.
Correct.
That is the recommendation.
Correct.
And if you are looking for the fruit of the womb, this is also very important. The reason why is because sleep helps to kind of restart your body. You know, when you stress yourself, everything is going haywire, your hormones are all over the place. The sleep helps to reset everything and make sure your hormones are in a normal range and normal level that you will need to conceive. So do everything you can to sleep if you can do anything, whatever it takes, but you need to have a good sleep. Good sleep is very good. It also reduces stress to your heart. True. It also gives you a peace of mind because once you have a peace of mind, then you're also going to be able to be more fertile. So sleep can never be overemphasized.
Thank you so much, Obi. In our community, our mantra is PPP. The first one is praying. The second one is playing. We allow our men and women to make love 48 hourly every other day. Now,
so that's there's a misconception that you should wait for the ovulation period.
Correct.
That is not correct.
Very wrong. You can see a cardiologist telling you guys the same thing we preach. The reason is because, Obi, majority of people that have problems in our community are women above 35. And most times I see women that come in, they frown when we tell them they are advancing maternal age. So they will be like, oh, you're making us feel like we are old. But a woman is going to age. And as you're aging, your eggs and everything is aging. So when you begin to wait for the time, you feel you are over, you can miss it. Because as you're aging, with stress, with this, with that, when you are not relaxed, when you're not drinking your water, when you're not sleeping properly, your hormones are going to play tricks on you. So the day you think you are ovulating, you will not ovulate. And once you miss that day in a month, you start all over again. So, Obi, you remember when we were taught Igbo, they said if the bird learns how to fly without perching, the dinter will shoot without aiming.
For sure.
So when we tell you to make love 48 hours, we are telling you because we want to make sure that we have adequate sperm in the vagina, because thankfully the sperm can last up to 7 days. So once you have sperm in the vagina and the egg decides to come by 12 a.m., the sperm can easily go and fertilize it. Unfortunately, the egg can only last for about 24 hours. So we don't encourage women, especially if you're from 35 years and above, to wait, because that day you're waiting might not be the lucky day. The eggs can play tricks on you. And in other end, Obi, when men were in their 20s, when they had flat tummy, six packs, without belly, before they start drinking and doing all those stuff, they can make love to their partner from infinity to infinity. But the moment you notice that your partner's libido is dwindling, the moment you notice that a young man in his 20s is having erectile dysfunction and his BMI is in 40s and he doesn't sleep, he's looking for a place to go and cut money, to make money overnight, he will not have time to make love to you 48 hourly. And your infertility will be man-made infertility. So what point are we making? If you can fine-tune your lifestyle, if you can drink your water, you watch what you eat, you sleep, you be mindful of what you put inside your body, The natural way that God made you to start your family will happen. Even if it takes time, it will happen. Your parents gave birth to you. But when you want to do this overnight, when you're not taking care of yourself and you want a quick fix, you're not going to get pregnant. And unfortunately, when infertility comes in a family, even Romeo and Juliet will start having problems. So, but when you do your own part, even if it's 12, it took you 2 years or 3 years, you're going to become parents. But go easy. Let's prevent things from happening. Let's not wait for things to happen before we begin to seek for help. I just wanted us to deviate a little bit to this end so that we can be more careful. Now, Obi, let's talk hypertension. Now, our people have this belief that, oh, you can take herbs. You know, even some people can use remote control to give people hypertension. So that's number one. Help us understand a couple of things they can do to prevent hypertension. Now, number two, I understand some families might have congenital heart issues. There are some familial heart problems in their family. So if the father had heart problem, if the mother had heart problem, if the mother had hypertension, diabetes, can it also affect the kids? And can it also affect the ability to start their family? So connection between familial inheritance, things you get from your parents, can it affect? Is it possible for them to develop that? Is it possible for it to affect their health? Please go ahead.
Okay. So when we come to heart diseases and hypertension and all that, so we kind of broadly divide them into things you can change and things that you cannot change. And one of the things you cannot change is who you are, your gene, your parents. You've been born already, so you can't change that. So what I'm trying to say in essence is that your family history is very important. And that is why when we are talking about history taken from patients, we ask them about, has anybody in your family had this disease? But even if you don't have that disease at that point in time, it's just something for you to be extra careful in the sense that you have to live healthy lifestyle, in the sense that you have to visit a cardiologist to look through, because if your parents or your maybe uncle has some kind of disease, it can go through your family and you may have them and may not know at that point in time. And that could also be affecting you getting pregnant in one way or the other. So it's something that if your family has a history of that, you should seek help with a cardiologist that can go through all the history, examine you, do some investigation, and tell you if there's something that can be done based on what the cardiologist has seen. So in terms of high blood pressure, like I mentioned a little bit about it, there are a lot of conditions that can also, apart from coming from your family, can make you have high blood pressure that can affect you also getting pregnant, like some hormonal problem. I talked about the thyroid. That is one of them. There's also an organ that is just above the kidney called the adrenal that can produce some hormones that can make your blood pressure also to go high. So, and that hormones can also prevent you from getting pregnant. So this shows that in terms of what you can do to help is know if you have a family history. You can ask your parents, if you don't know personally, ask them if there's anybody in your lineage that has had any family history of heart disease or that has died suddenly, because that is also very important. So if somebody has died suddenly, because maybe then we didn't know a lot in Nigeria what could have killed the person. So you need to find out from them too if somebody has died suddenly in your family. And then you should take extra care to live healthy, to exercise as much as possible, like we said, minimum of 150 minutes in a week. You should try to make sure your blood pressure is controlled. So check your blood pressure regularly and also see a heart doctor. You should also make sure you do not smoke, because that will also increase that risk. Make sure you drink a lot of water, okay? Because majority of almost 75% of your body is made up of water. So you need to keep replenishing that. Make sure you're not overweight or obese. So you have to kind of check your BMI, make sure it's within range and try to get it to normal range that it should be. Then if you also have diabetes that runs in your family, this is another killer, both for men, because diabetes can also give erectile dysfunction in men. And diabetes can also make you not to produce a healthy sperm.
Sperm,
So
correct.
these are things that also you need to check. So make sure if you're also looking for pregnancy that you check, make sure you're not, you don't have diabetes. So these are kind of things that you can do to help you in living a healthy lifestyle that can also help you in getting pregnant.
Okay, thank you so much, Obi. There's a question on the screen. So, guys, the question is now open. You can ask all your questions. We are quickly going to see how far we can go in attending to them. So,
okay,
please.
so I think the question is, what is the cause of congenital heart disease in a fetus?
Correct.
Also, can there be a recurrence of such? So the causes are kind of very many. Like we said, some are familiar. When we say familiar, it means it's been in your family. So that is why getting that history from your people will be very, very important in case you don't know. So get that history from your parents or your uncles or your grandmother or whoever that should know. Ask them, has any of this heart problem been in our family that you know of? So that is one of the questions that you're going to ask. So because some of them are familiar. Then some are due to what you did yourself. It could be, like I said, smoking, taking some drugs that you don't know. Some drugs themselves can have effect on your baby. Okay, so don't just take any drug by yourself. Let it be a drug that is prescribed by your physician, because the physician will know, and also let your physician know that you're either trying to get pregnant or that you're pregnant. So that we have different categories of medication from category A to category E, that they should not give you any medication that is not A or B in that category. So do not take anything herbal medication, because some of them we don't know what they contain. So they can harm your baby, they can give you some congenital heart disease and all that. So in summary, some can be due to your family, and also some can be due to what you did to yourself.
Thank you so much, Doc. And now we have a special event on the 27th, strictly, highly recommended. Fertile SGHS Symposium. We encourage every single person in attendance to register. We're going to look at your lifestyle. We're going to look at your love life. Then we're going to tie you to your fertility. It's going to be an event you don't want to miss. Now, Doc, what's your advice if checks X-ray shows cardiomegaly? I think this person has some medical background. So cardiomegaly means the heart is enlarged, right? And ECG shows left ventricular hemiblock and all this. She's just, I believe, but just quickly, give feedback. Layman response, please. Go ahead.
So layman response to this, and to make it simple, is that you should see a cardiologist. That's the most important thing. Because you did not tell me if the patient is having symptoms right now or not. But the layman part of it is that the heart is enlarged already. So it could be a sign of even more sinister thing to come. So make sure you see your cardiologist, and he will take a lot of history from you, including your family history. He's going to examine you, listen to your heart. He's going to also do some investigation. One of the things they're going to do is also called the echocardiogram, which is ultrasound of your heart. So go see a cardiologist, and he's going to take it from there.
Yeah, thank you so much. I'm putting summary of all the points Obi mentioned. So, but guys, the questions are open. Please start asking your questions. Now, Obi, in regards to BMI, please, can you tell us the categories of BMI and the one you advocate for our members to be in? Please go ahead.
All right. So BMI is usually divided, to make it simple for you guys, I'm going to use numbers 20, 25, and 30. Okay. So usually if you're less than 20, it shows that you're low, you're not in normal range. Then normal one is between 20 to about 25. Okay. Like I said, I'm not going to use point something, because if you want to really go into that point, but I'm just going to make it simple. So from 20 to 25 is normal, and that is where we usually recommend people, especially people who are looking for the fruit of the womb, to be in. That is normal BMI. Then when you get from 25 to 30 is what we call overweight. You are now overweight. And even that overweight is not good in itself, because at that level, your hormones are now going haywire. All right. So then above 30 is obesity. And we have different grades of obesity, from 30 to 35 and above 35 and above 40. different grades. But what we recommend is BMI of 20 to 25. That is the normal BMI. And that is where I would recommend everybody.
Okay, thank you so much. Remember, even a cardiologist is encouraging us to avoid ovulation sex. It's not recommended.
No,
Make
it's
love
not,
8 hourly. Now, Obi, this one is this lady is complaining about sleeping for 7 hours is impossible, being a mom. Obi, it's a proud father of boys and girls. And somehow you can see he manages to sleep. And he's a very busy man like me. So what do you have to tell this mom?
So what I will have to say is that I understand it's going to be difficult, but not impossible. Impossible should never be the word.
Correct.
I can understand if you tell me that it's going to be difficult, but it's not impossible. Even like you said, I have my kids. My wife also sleeps at least 7 hours every day. I have a very busy lifestyle as a doctor, but still, I know that this is what is going to be important for me to live a healthy lifestyle. So I make sure that I try to do it as much as possible. And part of what you have to do, so the body has a gland that is called the pineal gland that kind of secretes hormone that regulates your sleep. And when at night, you're always busy looking at the phone at night, there's a light everywhere, then it's going to affect that part of the brain. And that will also make you not to sleep. So if you want to do that, make sure you have a quiet environment. When the kids usually would have slept by then, and then you take a very good sleep, make sure you have a good quiet time and sleep very well. Because especially if you're looking for being healthy and also looking for just having a sane mind and also looking for pregnancy, you have to do everything that is possible to make sure it happens. So it's not impossible. It may be a little more difficult than somebody who doesn't have kids, but it can be done.
Thank you, Doc. Okay, so this next question says, what's the cause of low blood pressure?
Good. So let me say this, that low blood pressure sometimes on its own may not be a bad thing on itself, especially if you do not have any major symptoms. Because some people generally run in a low blood pressure range. But sometimes it could either be that you are dehydrated. So dehydration can be one of them. That's why we encourage you to drink as much water as possible. Sometimes it could be what we call autonomic dysfunction, whereby either because of diabetes or because of whatever has happened, the neurons in your body that control blood pressure are not functioning very well. And that could make your blood pressure to drop low. Some also may be because of medication that you're taking. So you also have to look at your doctor to know, is there any medication that I'm taking that could be a cause of this thing? And some could be the herbal medication that you're taking that you don't know what it contains, okay? So these are things that can lead to low blood pressure. So once you've done all those things and you are not doing anything that could be a cause of that low blood pressure, and your blood pressure is still relatively low normal, but you don't have any symptoms, then you don't need to worry much about it.
Okay. Now, Obi, some of our women have extreme problems when they bleed. They bleed excessively. Now, is it possible for a woman that, has menorrhagia, which is excessive bleeding, to be in the range of having, problems with the blood pressure? How can a woman probably losing blood internally and, bleeding excessively, which might also predispose to anemia, how can that come in line with blood pressure? Please, go ahead.
Good. So because blood pressure deals with, there are a lot of factors that control your blood pressure, okay? One of them is how good your heart is pumping. One of them is the volume of blood you have in the system, which also some part of the blood is the red blood cell, white blood cells, and platelet and other factors. Then others are the plasma, which contains also fluid, water most especially. So if you lose a lot of blood, like you said, it could lead to anemia. It could lead to reduced volume of blood inside your system. So that could also lead to a low blood pressure. So in that case, you also will need to see your gynecologist, and they will have to be checking to make sure your blood count is within normal. And if need be, if you need to be on any iron medications or blood transfusion, or depending on what your gynecologist has decided that you need.
Okay, thank you so much, Doc. What's the cause of having the heart on the right in a baby?
So having the heart on the right. So if I understand this question, what we call it in medicine is dextrocardia, where the heart is of being. So let me show you this.
Predominantly on the left.
Yes.
The two sides of the body can have some level of the heart, but it's predominantly. But Obi, go ahead, please.
Yes. So usually your heart is more tilted towards your left side. It's going to be almost like this. But in some people, instead of being that, it goes more towards your right. If that's the question that the person
I believe that's what she's asking.
Yeah, so that's what we call dextrocardia in medicine. So it's a congenital disease. To be frank with you, dextrocardia on its own, if it's just dextrocardia on its own, doesn't really give you much of a problem if all the blood vessels from the heart going to different parts of the body are still the same way they are.
Correct.
But if maybe the blood vessels are interchanged or interswitched and all that, then that could be a problem. So if you have a baby who has that, then you should see a cardiologist and they'll have to look at that and see if it's something that is in isolation that doesn't have a problem, or if it's something that has a lot of disconnection between the blood vessel that needs to be repaired. Because without that, if it's a complicated one, if it's not repaired, it's going to be a problem for the child.
Correct. Actually, this is what happens to some sports, people. They won't know they have a congenital problem. So congenital heart problem means when you were born, you had a heart problem, maybe a hole in the heart or the vessels were not connected properly. If you guys remember Kano, a popular Nigerian footballer, he was actually blessed and lucky because he could have died suddenly and they would say that someone gave him poison in the village. But he had a congenital heart problem. They identified it and he was lucky because it can be expensive. They took him to a cardiologist and they were able to operate on him and correct all those stuff. And he was able to still come back and still continue playing soccer. So the ability to connect to the right kind of provider is very important.
Very important.
The same way Obiora is a cardiologist, we also have pediatric cardiologist. So if you're a new mother, before they send you home, they will want you to establish care with a pediatrician. So they will check every singular aspect of the baby to make sure that the baby is doing good. So if your baby has any problems with the heart or whatever, you have to go specifically to pediatric cardiologist. You are not going to see Obiora. Obiora is the big boy in cardiology. You're going to see the baby cardiologist.
The cardiologist that sees the baby actually. Yeah.
Correct. So Obi, what causes heartburn? Go ahead.
Okay. So heartburn is a term that lame term that is used to describe a feeling where just around behind your heart or around your heart, you feel like a burning. So majority of the time, it's actually due to acid reflux that come from your stomach because your food pipe connects to your stomach. And in the stomach, there are a lot of acid that is produced that is helping in digestion and all that. So, and there's a kind of a little, I would like to say, valve connecting that part too. So if there's a problem where the acid goes up into the windpipe, usually it causes heartburn. That is the majority cause of heartburn. But having said that, in some women, heartburn can also be a sign of heart disease. So you wouldn't know. So the best thing to do is to get evaluated to make sure it's not due to heart disease, because women have what we call atypical symptoms, where a normal man will have, I'm having chest pain. When I walk, I feel like my chest is hurting. But a woman may just have heartburn and not present with the typical symptoms related to heart attack. So it's good that this person also makes sure it's not something sinister.
Okay, thank you, Doc. Now you've mentioned heart attack. Please, can you tell us a little bit about what heart attack is all about? Is it evil attack from people from the village? What are the likely symptoms and what can lead to heart attack? Please go ahead.
Okay, all right. So I'll still go back to my model here, right? Correct. So this is the heart, and you see this is a blood vessel here supplying the heart. Okay, so I'm going to magnify this blood vessel here because this blood vessel supplies the muscles of the heart. Okay, so this is the magnified version of the blood vessel again. You see, it's a pipe. Here is so clean. The inside of the pipe is so clean. No blockage anywhere on this part here. But coming to this part, you see this blockage here. Okay, so when this blockage, so the heart has a way of trying to compensate initially when the blockages start happening. So, but over time, it gets overwhelmed, especially when you keep doing the wrong thing. It gets overwhelmed that the narrowing or the blockage becomes too severe. And that part of the heart, the muscles of the heart do not get blood supply anymore. And once that starts happening, usually you have maybe like chest pain, or you're even short of breath, or feeling dizzy or to pass out. So these are some things that you can have. But like I said, women sometimes have atypical symptoms that are not these typical things I talked about, where when you walk or when you do something, you have chest pain. So some women will have atypical symptoms. So when this closes completely, it's called a major heart attack. And usually you see most patients may not survive, some will survive, depending on what is done, the intervention that is done or not done and all that. So, and these are things that when somebody dies from, some people say it's the evil or village people that did that. But it could be because this blood vessel is completely blocked. And that part of your heart, because the heart is like the generator, just like if you cut fuel from a generator, it's not going to work anymore.
Correct.
So
Correct.
when the heart is not working anymore, it stops beating, then the person can die. So that's the heart attack.
Yeah, thank you so much, Doc. So a young man in his late 30s just came back from village and suddenly he went for jogging and collapsed and died. And he started panicking and connected immediately to the recent visit in Nigeria. So in that situation, in medical field, there's something we call differentials. So what will make a young man in his 30s, athletic, suddenly have this fainting attack, collapses and dead on arrival? Please, can you educate us between the connection and does it have anything to do with the village trip and all that? Sudden collapse and death.
So what I basically try to do is to try to do things that we can control, things that make sense scientifically. And it's possible that the young man, I don't know the full history, it's possible that the young man may have some undiagnosed heart condition. It's possible the young man may not have had healthy lifestyle. These are all possibilities. Then another thing that is also possible is that sometimes some people, when they travel a long distance, they can develop some blood clots in the legs, and that blood clot can go to the lungs, and that can also make somebody die. So I don't know the full history of this person you're talking about, but the differential could include heart attack. It also could include a blood clot in the lungs.
Yeah,
so these are things that usually make, we call it PE, pulmonary embolism. Yeah, so these are things that can make somebody die suddenly. So sometimes, like I said, it's undiagnosed heart problem.
Correct. Now, Obi, you mentioned something about traveling. So people that travel from Nigeria to America, they stay about 13 hours. What do you advise people in regards to preventing heart problems when they are traveling?
So usually what I tell people is try to, from time to time in the flight, stand up, walk around, go to the toilet, bathroom or whatever. Just make sure you're more active. When you are sitting down, just try to be moving your legs and all that. Because ideally, like you said, young people may not have that risk of having blood clot, but you don't know if their family, if there's a history of blood clot in their family, that even though, yeah, as a normal young person, you should not have that, but because of that history, so there's some family that have that tendency to develop blood clots. So those kind of person, if they don't know, they may go into the flight, sit down all the whole 13 hours. Then by the time they land, do small thing, they start having maybe chest pain, and from there they die. So try to be active if you're in a long journey or long flight, even if you're driving for like 10 hours or 7 hours and all that. Try to take a break, come out, sit down, walk around, do this. Just try to maintain some activity and not just sit down the whole of the time. Like you said, that sitting down or being inactive is the new danger in the block. It's even worse than smoking now.
Correct. So you need to move. Now, yeah. Obi, can a man with pre-diabetes impregnate a woman? She actually asked a direct question. So what do you have to say about that?
So pre-diabetes can also affect somebody. We have to make sure that at least the person gets a good medical attention, because it can affect somebody, right? And it can also lead you to even eventually developing that diabetes. I've seen some people with pre-diabetes having erectile dysfunction. I mean, men, I've seen that. So yeah, it can affect somebody. So the person should get medical attention and get treated as soon as possible.
Correct. So it's a risk factor, guys. So yes, it can. It might not be directly, but it can, because if a man has pre-diabetes and he's not doing the right things to reverse that, he can actually have full-blown diabetes. And full-blown diabetes can affect any part of the body, including the nerves and blood supply to the penis. When it affects the nerves and blood supply to the penis, the man might have erectile dysfunction. And if it affects the hormones too, the man will not produce adequate level of quality sperm that will get the woman pregnant. The man might not be able to maintain the frequency of lovemaking that will get the woman pregnant. So whether directly or indirectly, it can happen. The reason why you are pre is to sound a note of warning so that you don't graduate to real confirmed diabetes. Some women can develop pregnancy-induced diabetes or pregnancy-induced hypertension. If you are mindful and careful, once pregnancy is done, you reverse back to normal. But unfortunately, some women, if they are not careful, they will develop frank diabetes, frank hypertension. So the idea is to make sure at any point in time, you are in charge of your life. What you do every day will see you through and can even manifest in your baby. Now, Obi, what if you already have high blood pressure? Is it possible to reverse it?
So, first of all, you have to listen to your doctor. If your doctor prescribes blood pressure medication, you have to take them religiously. What I tell people basically is that high blood pressure is more of a chronic illness. It's not just something that, oh, I take my blood pressure medicine today and then I don't take it tomorrow. In fact, I have some people that tell me sometimes from Nigeria that, oh, I check my blood pressure. If it's not too high, I don't take my medication. If it's now too high, then that's when I take my medication. So first of all, you have to listen to your doctor and know that this is going to be a chronic illness that can be managed. But you can also do some things that can help you to almost get to that normal level that your doctor, having seen everything, can decide that, okay, we don't need to be on blood pressure medication anymore. All right. And these are things we talked about: losing weight, being active, exercising, and all that. All those things we mentioned already. So you can do that, and your doctor can keep on following you. And if the doctor feels that your blood pressure can be controlled without medication, then your doctor will tell you to do that.
Okay, thank you so much. So guys, BMI calculation is on the screen. Just like Dr. Obi mentioned, we want it to be within the normal range. So my COO actually did a couple of permutations. So if you don't know how to calculate your BMI, we need your height and your body weight. Once you plug the number, we want you to be below 25. We don't want it to be above 25. We don't even want it to get to 30, both for the women and men, because the higher you get, the more difficult it becomes. And unfortunately, these chronic conditions are conditions you will live with in life if you're not careful. And that brings me to the next question, Obi. Is it possible to cure hypertension completely?
So I'll have to say that in my practice, I've seen people who eventually did not need blood pressure medications, okay? Having said that, I would say that the number is not that high, but it's possible. I've seen people who have been treating with blood pressure medication for high blood pressure, and over time, with healthy lifestyle and healthy living, they were able to come off some of their blood pressure medication. And some people actually came out completely of all the blood pressure medication. So it's possible, but you have to do your own part first, and do not stop your medication unless instructed by your physician.
Correct. Okay, thank you. So also my admin summarized the range where you need to be. Now, Obi, I know this is not your jurisdiction, but I think this lady is saying something about the womb size.
This is not my jurisdiction, right?
I don't want to go into the academics. It's kind of confusing, but I'm going to say this. Anytime you have a lot of cells in any part of the body, increase in the expected number is called hyperplasia. Now, when you have all those cells, they will lead to enlargement. Now, the normal womb size, I'm not going to bother you. Every woman has a specific individualized womb size. But sometimes if you have any problem inside the womb, they will begin to enlarge. Things like fibroid, endometriosis, adenomyosis, polyps. There are so many problems that women can have. So anything that affects the original design of your womb can impact on your ability to become pregnant or might lead to miscarriage. So the key one you have to do is to make sure you follow up with your provider. And the earlier we do this, the better. Obi, can energy drinks cause heart problems? Please go ahead.
Oh yeah. I've seen a lot of people who were on so many energy drinks because some of them contain some chemicals that can make the heart pump faster than it should be, and that is putting more stress on the heart. That can also increase your blood pressure. So it can cause a lot of heart problem. I've seen that in a lot of patients, and I tell them stop this hard drink and energy drink. Sorry.
Correct. Now, Obi, this lady is asking, Doc, can the 7 hour sleep be divided within the day? So like,
this,
when we were in secondary school, we used to have siesta, right?
Siesta, yeah.
And during our siesta, we just be, creating, talking all over the place. Before you blink, your 2 hours is over. So can she divide her sleep in the day?
All right. So if you want to get the full benefit, it should be uninterrupted sleep.
Mm-hmm.
If you want to get the full benefit. But what I would say is that even little sleep is better than no sleep at all. So, but if you want to get the full benefit, it should be 7 hours of uninterrupted sleep.
Okay. That's straight and simple point. Now, Obi, I know OBGYN, it's not your jurisdiction, but you took a lot of courses in OBGYN, and I'm going to default to you to answer this question. Please bring in the organ and, the things this lady, needs to do. And also she's had 3 miscarriages. So let me just start and then I'll bring you in. So when you've had 3 consecutive loss of your pregnancy, so miscarriage is the unintended loss of your pregnancy before 20 weeks. If you lose your pregnancy beyond 20 weeks, it's called stillbirth. Now, when you've had 3 losses, that means your 3 previous pregnancies ended in miscarriage. It's possible the reason is what we call chromosomal abnormalities, which is going to happen. It's going to happen. When your 2 parents came together, the mom contributed 23, the father contributed 23 to make it 46 set. So in course of doing that, the chromosomes might have problems and all that, and the body wants the best. Once the body doesn't get the best, the body will find a way to expel it. So that's what happens in most cases. Now, there are other likely things that can lead to miscarriages. It can be infection, it can be hormonal, it can be structural, it can be cervical incompetence, it can be anything. So the key word is to go for further investigations. There are advanced investigations that a high-risk pregnancy specialist will conduct. So I wouldn't want you to go for another pregnancy by trial and error. Because Obi, what I've noticed in our community, once a woman is not able to bring forth her baby, once that bleeding stops, some of them will not even go for evacuation. They will quickly want to convince their partner, their mother-in-law, their mother that they can become pregnant. So they have not fixed the foundational issue that might have led to that. They didn't go for investigation. They didn't have any report, but they want to quickly prove to the society that, yes, I can become a mother. Now you've had 3. We need to go easy to discover what might likely happen. When you become pregnant, you are now classified as high risk. So you need to be sent to an advanced doctor that will keep an eye on you and make sure you at least have your baby in your hands. Now, you also have another factor. Your blood group has a negative. So anytime you have a negative in your blood group, it means you don't have a particular protein we call rhesus factor. And when you don't have that and your partner is positive, so we are only worried when it's in the women. If a man is negative or positive, we don't care. It's when the woman has negative in her blood group. Then it means when she has her first encounter with becoming pregnant, her body might likely be sensitized and produce soldiers which will attack the baby she might have in the future if that baby is positive. So most first pregnancies will not have problems. So what we normally do in this situation is to administer a preventative drug we call ROGAM to any woman that has a blood group negative and the partner is positive. Like in your situation, you are negative, your partner is positive. So we want to give you these drugs for all your pregnancies to make sure you will be protected. But having said that, Obi, is there any link, any relationship between the heart and recurrent or habitual miscarriages? Please go ahead.
Yes. So a lot of congenital heart disease can lead to also miscarriage. So if somebody, like you said, if somebody has had multiple miscarriages, it's good for the person to check. In fact, part of what they do here is that if they're able to, if you get pregnant, they can take some sample from you to see if the baby has some chromosomal abnormality. Some chromosomal abnormality can also give you congenital heart disease. So, and some babies, some congenital heart disease, they don't even make it in life. Some of them are miscarried in the womb. Some of them, once you give birth to them, they die immediately. So there's a link between congenital heart disease and miscarriage. Yes.
Thank you so much. Straightforward. Now, Bobby, what causes pain in the chest when coughing? What are the differentials?
Okay. Yeah. So you rightly brought up a good word, differentials, because it doesn't mean it's only one thing that can cause that. So there's so many things that can cause that. And one of them, when you cough, could be either there's a blood clot in your lungs, that when you cough, it irritates the area and can give you that pain. The other thing is just inflammation around also the lung area. If you have any kind of inflammation, maybe you've had upper respiratory tract infection, virus infection that can lead to inflammation around the lungs, it can give you that. It could also be just a muscle, you know, maybe you tore a muscle while doing something or carrying something and all that. When you cough, you can also have that pain. So these are some of the things that can give you pain when you are coughing.
Thank you so much. So when I use differentials in medical terminology, we don't just say someone will not have pain and come to Obiora, chest pain, and Obiora say, oh, you have heart attack, oh, you're dying. No, we have likely things. We classify them top down. So that's what's called differentials.
Yeah.
We take time to go through steps to discover what the problem is. If you notice in our organization, I'm the last person to tell you what might be the problem if I don't have the full history. If you also notice, when I tell Obiora certain things, he will say, I don't know the full history. So we are not magicians. We take time to discover what might be the problem. Now,
this is a very good point you brought up, because sometimes I get called from Nigeria and they'll be like, oh, doc, what is the cause of this? And I'll be like, I've not seen you. I've not examined you. I don't know your history. So we're not magicians. We're not like, I have a magic wand that, I know what is wrong with you. So that is why in medicine, you take the history, including the family history, you examine the person and also do some investigation. When you've gone through a whole lot from the history and physical examination, you can now narrow it down. So you may start with maybe 10 possibilities. And then after you've taken the history and the physical examination, you may narrow it down to 1 or 2. And then you do your investigation. That will not give you what it is.
Correct. So, and in regards to that, you know, I'm not gonna include her name. One of our aunties. So she actually sent me a message this afternoon, and she was like, "Nah, please prescribe me some very, very good drugs. I can't believe I'm in this America and you guys are all over the place. Prescribe me very, very good drugs that will nourish my body." And normally, the only good drug I prescribe is what? Multivitamins. Once is that, we don't have magic drugs. And guess what, Obi? She was disappointed.
Yeah, and you know what people don't understand is that any medication, anything that we do basically in medicine has a risk and benefits, right? So if the risk outweighs the benefit, we don't recommend it.
Correct.
Then if the benefit far outweighs the risk, then we can tell you, okay, yes, we need to do this because the benefit far outweighs the risk. So any medication you're going to take may have some side effects, you know, and without me knowing your full history, knowing, do you have some kidney disease? Do you have some heart disease? And I'll give you a medication without knowing that. And it can even make the condition worse for you. So first thing we try to do in medicine is do no harm. So for me to prescribe something for you, I need to know all the details, because I may give you a medication that makes things worse, and you come back to say, oh, this doctor doesn't know what he's doing.
Correct. I remember my experience when I was in Nigeria, and, you know, normally they heard about this guy, oh, he's very good. This particular, I was in one of the Air Force hospitals. So this particular guy came in, he was expecting to have about 6 different drug medications, and in course of my history, there was no need for drugs. We just cancel, we talk. So when he was leaving, he was saying, "Doc, where are my drugs now?" I said, for now, we don't have any different drug. The guy left and started telling the whole camp that this guy doesn't know what he's doing.
Doesn't know, yeah.
The only crime I committed was the fact that I didn't give him all those antibiotics. So the number of drugs you give people in Nigeria will qualify you if you're good.
Yeah, sometimes you don't need any drugs, actually. Yeah, sometimes you don't need drugs.
Less is more.
Yeah.
In medical practice.
Yeah, sometimes you don't need drugs. Like if you do the right thing, you may not need drugs. So it's not always that drug is the answer.
Correct. Yeah. True. So someone is asking about prolactin, and I'm going to make this brief. Yes, if your prolactin level is high, thankfully there are some drugs we will give you to make sure it's within normal range. The problem is when you are not pregnant or you are not breastfeeding and your prolactin level is high, it will affect the normal function of the other reproductive hormones, so you might not ovulate. But thankfully, we can give you some drugs that will bring your prolactin level within normal range. So if that prolactin is the only problem you have, then you will have a better chance of becoming pregnant. But pregnancy is a very complex problem. So we can fix your problem, then the other problem might be coming from your man. So it's not only women that have problems in pregnancy. Men can also have problems. Unfortunately, some men do not submit themselves for investigations. So you need to submit yourself for investigation. So we might also decide if it's coming from you. Okay, Doc, how can one usually have how can one prevent high cholesterol? Pretty much. Go ahead.
Okay, so cholesterol, the body produces some cholesterol, and some are also based on what we take in as humans. So one of the things to do to reduce the cholesterol your body produces is being physically active, exercise. So exercise will help to reduce the cholesterol. And having said that, let me bring up there's a good cholesterol and a bad cholesterol. So the good cholesterol will help to remove some plaque, take it back to the liver where it's going to be destroyed. And the bad cholesterol will deposit it here. Okay? So one of the things you're going to do is to make sure you are very physically active. You exercise every time. Be active, lose weight. If you have diabetes, have it very well controlled. So these are things, some of the things you can do. Then in terms of diet, you have to make sure you eat less cholesterol-containing food. And so also when we come to fat, we have what we call saturated fat and unsaturated fats. So saturated fats are not good for your body. Unsaturated are better for the body. So exercise, losing weight, being active, and also watch your diet.
Correct. And having said that, some people might need drugs. So if after all this, you go back to your doctor, and if OB feels they need to give you cholesterol drugs, he will give you under control. Don't take it by default. Don't initiate it. Make sure you follow through. Most of the medical problems you have in life can be corrected to an extent by lifestyle modification. So before you begin to think about drugs, see what you can modify in your life every day. And most times, remember, our great-grandfathers didn't have doctors. Our great-grandmothers didn't have doctors. If you go to your village, I don't think there's anybody that is obese in your village, right? Because they go to their market, they go to the village stream, they stay active. They can eat carbohydrates night, afternoon, and day, but they are active and they live far into the hundreds. So our lifestyle is very important. Now, Obi, what's the best method of family planning in regards to someone that has hypertension? Just go generic. Don't be specific.
So basically, I have to, like you said, go generic here. So the best method would be something that will not increase your blood pressure. So anything that will not increase your blood pressure will be desirable, because some hormones can increase your blood pressure. So I'm not going to go into the specifics, but anything that can not increase your blood pressure will be desirable.
Correct. Now, to add to Obi's point, there are some lifestyle you might be living that might potentiate your ability to develop problems, including cancer. So if you don't exercise, if you have multiple sexual partners, if you smoke, if you drink alcohol, and you have family history of hypertension, guess what you're doing? You are knocking on the door of hypertension, diabetes, obesity, cancer. You are telling them, come and get me. So one poor lifestyle can drag every other thing. And from your experience, Obi, most people that have hypertension might develop diabetes. might have obesity, might have cholesterol problems, and at the end of the day, they end up having syndrome X.
Yes. So most of it.
Go ahead.
Yeah, most of the time, those lifestyle come as a package, you know, because you see people who are not physically active, they get bigger, they develop diabetes, they have high blood pressure at the same time, and their cholesterol will go high because they don't do any activity. And in fact, there's a study that was done, published in France. They looked about 64 female who were having trouble to conceive, and another 64 female who were not having any trouble to conceive. So those who were having trouble and those who were not having trouble. And what they found out that most of the ones who are having trouble to conceive have a lot of all those gamut of problems. They are either obese, they have high cholesterol in their system, their blood pressure is not well controlled, and all that. So they usually come in a package. So one thing may lead to another and then complicate the whole matter and all that. That's why we talk about making actual plan to change your lifestyle to live a healthy lifestyle.
Thank you so much, Obi. I'm going to address this. Now, the normal bleeding day in a woman is 2 to 7 days. That's the normal range. If you are not bleeding up to 2 days, we are worried. If you are bleeding more than 7 days, we are worried. So we want you to be within that range. Some women can start up bleeding for 7 days, then they come in the middle. Some women over time will be reduced. That's okay. So just bear in mind in this way. Now, you're talking about family planning. So family planning is simply contraceptives. And some women might have adverse effect when they use some family planning. So if you're using family planning and you have adverse effect or side effect, the right thing to do is to go back to the doctor. Don't stop or continue any drug by yourself. Follow through with your doctor. Now, Obi, there is this practice among women in Nigeria in regards to after morning pill, emergency contraception. They have now been binging on Postinor 2. Now, can you connect the abuse of Postinor 2, lifestyle, and likelihood of having some cardiac issues in the future? Please go ahead.
Yes. So, Postinor 2 or morning after pills are not meant to be taken regularly. This is something that shouldn't be like a frequent stuff, because the amount of hormones that is contained in those can actually affect your heart, can also increase high blood pressure and all that. And Chudi, maybe this is your area too. I think it also has something to do with infertility in the long run.
Correct.
So yes. So, but it's not good for the heart, and it's not meant to be taken frequently.
Correct. So the problem with taking Postinor 2 is this. Because of your lifestyle, when you take Postinor 2, you are introducing exogenous hormone-based drugs to your body.
Yeah.
You might not be eating properly. You might not be exercising. You might have multiple sexual partners. So if you have multiple sexual partners and you pick up HPV, human papillomavirus, is a risk factor to developing cervical cancer. If you are not eating properly, or you eat a lot of carcinogens. So carcinogens are cancer-causing substance. You are now adding your risk factors. If you have family history of cancer in any of your generation, then you have potentiated the development of that, because by the time women now marry, they start abusing clomid, which is another hormonal-related drug. So the more you take some drugs you don't need in your body and you have other risk factors, the more you're going to increase the possibility of developing problems. So don't use anything that your doctor give you at all. Okay, now this person is asking about calculating BMI. I'm going to give you the assignment, because what I've discovered in our organization, when we do everything for our members, they tend to relax. Now, if you have identified your body weight and your height, then you follow my COO and go and do the maths and show all workings. Obiora, when we were in secondary school, we don't just copy the answer, right?
No.
Show all workings. Sometimes you will not get the answer, but they will give you scores for attempts. Now, Doc, can high blood pressure drops stop one from conception? The drugs. Does it lead to
high blood pressure drug stop one from conception?
Correct.
So, high blood pressure drugs, there are different classes, and some of them can actually maybe reduce your likelihood of getting pregnant, and some also can actually harm your baby if you eventually get pregnant. And that is why if you're either planning to get pregnant or you are pregnant already, you should discuss with your doctor so they go through all your medications and know which one is safe for you and which one is not safe for you. And if there's one that is not safe for you, they're going to make adjustments.
Yeah, thank you so much, Obi. Thankfully, for the first time, we're able to attend to all the questions. So we've exceeded our time, but thank you so much, my brother, for giving me this opportunity.
Thank you.
Now, it's blood pressure of 121/95 with pulse of 87. Okay for BFB. BFB is our acronym for Believing for Baby in our organization. So can Sandros correct the diastolic? Maybe this lady is trying to form medical doctor. You just dropped the diastolic for us to form. Simpler things, my people. So in your blood pressure, the one on top and the one below, there are names we call it, but we don't want to confuse you. But Obi, please go ahead.
All right. So what I would say here, if you follow the new guideline, so the lower blood pressure here is already 95, meaning that the person is already hypertensive, because it's not just the top number we're looking at, we're also looking at the lower numbers. But what I would say is this person can start with lifestyle modification at this time and see how it goes. But you need to see your doctor as soon as possible, because your doctor will need to look at a lot of factors. You know, sometimes we do what we call a risk calculator, where we look at the overall 10-year risk and decide, do you need medication or not? So you have to start from all the lifestyle modification we talked about today and see a doctor, and the doctor will decide if you will need a medication or not.
Okay, so Obi, this one should be to you. Why some pregnant women don't sleep at night? Because she has had 3 babies and she doesn't sleep at night. What might be the likely reason why a pregnant woman will not sleep? And what advice will you give this pregnant woman?
I think this is more like your area.
Now you're the interventionist now. What can you advise to prevent, and what are the likely things that might affect this woman if she doesn't sleep?
Yeah, so I know from the little I knew about obstetrics and gynecology when I was in medical school that pregnancy comes with a lot of hormonal, some hormones become too high and all that. So that's a possibility that those hormones can maybe prevent this particular lady from sleeping. But basically, I still will refer you to your doctor, a gynecologist or obstetrician, depending on what level of pregnancy the person is at that time, to look at everything and know what is right for you, because no one size fits it all for us, basically. So the person has to look at you, look at everything, and decide, what can we do to help you to sleep,
Yeah, thank you, Obi. I'm taking you through CE in OBGYN. So the question on the screen is still for you to review your knowledge in Enugu. So please, ask for bromocriptine. If a woman is on bromocriptine, is bromocriptine gonna help that woman to become pregnant or gonna make it difficult? Please go ahead.
So let me ask first, why is the person taking the bromocriptine in the first place? I want to know.
Hyperprolactinemia.
Hyperprolactinemia.
Yeah.
Okay, that's why the person is taking it.
Yeah.
If the medication was prescribed by a gynecologist or a physician, there has to be a reason, because if your prolactin is high, then it's going to prevent you from getting pregnant, and that's the reason why they give you that medication. So it's possible the medication will help you to actually conceive, if that's the reason why they gave it that. But like Trudy mentioned earlier, infertility is a whole gamut of things. It may not just be that prolactin. So, but if it's just that prolactin that is the problem, then you'll be able to conceive. But if there are other things that are the cause of why you're also infertile, then all those other things will also have to be addressed.
Correct. Obi, I'm going to brag. My COO is an engineer. So she has calculated the BMI of this lady. Her BMI is 40.4. What do we have to tell this woman to save this woman? A BMI of 40.4.
So this is actually what we call morbid obesity. Morbid obesity, meaning that morbid means, when you talk about morbid, it means a very bad one, actually. So this person, basically, I don't know how old the person is.
It's a time bomb.
It's a time bomb. It's a time bomb waiting to happen. So something has to be done, and done drastically for this person. starting from lifestyle, but this person needs to see a specialist right away, so that they will look into everything and see if there's something that they can do to help. Because with this BMI, it may not just be simple lifestyle modification that this person will need. This person may need more advanced therapies and all that. So, but start from what you can do right now in terms of trying to be physically active, exercising more, watch your diet. If you're smoking, you stop smoking. Make sure your diabetes, if you have one, is very controlled, and also blood pressure, make sure is well controlled. But try to see a specialist.
Correct.
And they will take it from there.
Correct. You have to be careful. We are not prophets of doom, but you cannot have BMI of 40. No, you have added extra 10. We are worried at 30, but you have 40.4. Now, if you're in believing for baby category and you are complaining you don't have a baby, our major concern in a woman that has 40.4 is not to have a baby, because somehow you might go and have a baby, but you can have a lot of complications, including death. We want to control your blood. We want to control your BMI to a manageable, healthy range before you begin to think about pregnancy, because there are so many things that can happen to pregnancy that can complicate it. So we cannot afford to address any woman having infertility with morbid obesity without addressing the obesity first. This is morbid. It means there are so many damages going on in your body, you don't even know. Take this serious. Don't go to the don't go and look for olive oil, or you jump from one church to the other, or they come and bind and cast. Please see a doctor. Very, very important. Okay, very important. Now, Obi, why do you guys give pregnant women aspirin?
Okay, so aspirin has been shown in some pregnant women to be helpful. One of the reasons that one can give aspirin is that aspirin, for those that don't know, is kind of a small blood thinner, kind of helps to thin your blood. So maybe for people who have some disease in the blood, or maybe with tendency of having a blood clot and all that, maybe that can also be helpful. In other ways, also, some studies have also been shown. I'm not a specialist in gynecology and obstetrics, but some people who also have preeclampsia, I think also they also may benefit from aspirin. But do not take the aspirin unless it's prescribed by your doctor.
Correct. Obi, is cold water good for heat?
All right. So basically, for me, I prefer normal water. Personally, for me, I don't usually drink cold water. But having said that, there's not been like a head-to-head comparison. You know, sometimes in science, unless you have a head-to-head comparison between maybe cold water or normal warm water, then you'll be able to say for sure and make an association. But if you can, what some people have opined, and this is just personal opinion, is that cold water may actually be a little bit more dangerous than normal water. But this is just opinion. But like I said, there's not been any head-to-head study that was done. So I prefer to drink normal water instead of cold water, personally.
Okay, so I'm going to come in. Water is water. So long as your body is not going to burn, so whatever way your body accepts water is going to process water once it goes into your body. And like one of the Nigerian singer, fella, water no get enemy. Water is your friend any day. Though, if you exceed, you can have water intoxication. So everything in life is balanced. So if you begin to just go and feed on water, it can neutralize a lot of things in your body. But when you take it adequately, it's helpful. Now, if you're in a cold place, Obiora has lived in so many cold places. Currently, the area he's living now is a little bit, cold. You can see how I'm kind of trying to clean my sweat because I'm in Florida. He's in a different place. So the question is, whichever atmosphere, whichever environment you find yourself, the water that will suit your body will be okay. But like you said, we do not have any jury come back and say categorically, this is bad or this is good. Now, guys, we should be wrapping up any moment from now. Now, this lady has stopped breastfeeding 4 months ago and she's still producing milk. She should be worried? No. Now, the question is, once you have been expressing your milk, It doesn't happen automatically for everything to be reverted back to normal. So it takes time. So right now, 4 months, I wouldn't be worried whether your breast milk is coming out or not. Give you some time, then go back to your OBGYN and we can take a look at your level. Then if need be, we can begin to think outside the box. But if you ask me, I'm not worried about this. Now, Obi, can infection be treated finally? Because she has been treating hers for long. Now, this is one of the questions we received. Let me tell you what happened. Majority of our members take themselves to the lab. The doctors do not recommend. Maybe the lab scientist, maybe their neighbor that cleans house in the hospital. Oh, my neighbor told me to go to the lab. And anytime they go to the lab, they must see moderate growth of Staphylococcus aureus combined with heavy growth of Candida albicans. And they come back, they are freaking out. They gave me antibiotics and it's still coming up and down. Doc, do we have any connection between Staphylococcus aureus and Candida albicans? I know it's not your area, but you remember your OBGYN. Is there any way that this staff, what is this stuff and why has it been costing a lot of people a lot of money?
This stuff has caused a lot of problems.
A lot of problems.
Everywhere you go, you hear stuff.
I know. Please go ahead.
All right. So this person has not told me what infection is being treated for and who, like you said, who is treating it. Is it self-medication? Mm-hmm. Is it prescribed by a doctor? So I can't really answer this kind of question, but I'm going to make a general statement that Candida and stuff that you know should not be actually treated unless the stuff is in the bloodstream or that we worry about, or there's a wound anywhere and all that. But like I said, I don't know the kind of infection this person is talking about. Who did the test? Why was it done in the first place? Who is prescribing the medication? How many, so I don't know the details, so I can't say for sure.
Obi, this is what we call DOA in OBGYN. There is no association between your staff and your candidate and fertility.
Yeah.
Are all construct in Nigerian lab here in you guys. It did not pass the smell test. So I know you're trying to be medical legal in your diplomatic response. But me, dead on arrival, don't go there. Okay? Remember that Candida, it's a fungal infection. Unfortunately, some of them will have Candida and they give them antibiotics. So they kill the normal flora and they get exposed to now things that will begin to affect them. This person is asking about menses for 2 days. Remember, 2 days is the lower limit of normal, right? And 27 days normal. I'm not worried about that. Okay. Now, this person is asking about the BMI. I want you to go and do the math by yourself. You weigh for 54 kg, 160 cm. Just plug in the numbers. You've been struggling with your weight. Will it be safe for you to go for IVF if you're underweight? Obi, please come in this regards. What's the likely implications of a woman not having good body mass index and she's paying a lot of millions to go for IVF? Please, what do you have to tell them?
Yes, so one of the things, like we said, is that your BMI being abnormal is going to affect you conceiving in any way, both IVF or normal way. So if I were the person, I would try to get the BMI sorted out first, instead of wasting a lot of money trying to do something that may not work because of your BMI. So, okay, so this BMI is good, 21.1. So that's very good.
Correct. Guess what? My COO just got it correct.
Your COO is very smart.
Very smart COO.
Yeah, so this person's BMI is very good, 21.1. So this person is healthy. So go ahead.
Correct. No, you don't have any problems, okay? Yeah. So you're within the normal range. Okay, guys. I believe we've come to the end of today's broadcast. Now, Obiora is an ego. We don't get him every day. I think the last time, Obi, you came in was way before COVID. That was the last time you came to my organization. But hopefully, I'm your brother. In our family, if the big brother wants something, he will get it. So we're going to get you back. So we're going to get you back. We love you always coming back. Thank you so much, my brother.
Thank
for
you. And
bringing
I
out
want to
more.
just say something, and also, like I started by saying that thank you very much and your team for all you have been doing. May God bless all of you. And I pray that whoever is looking for the fruit of the womb through this program and subsequent program, you are going to be blessed. And try to live a healthy lifestyle. Do your part, and then leave the rest to God and also to the physician. But at least do your part. Let it be that you've done your part, and then God will do the rest for you.
Thank you so much. There's another question that popped up. How can she treat STD finally? You know how people love finally.
See your doctor. That's what I'm going to say.
Exactly. And yes, you can treat it finally if it's bacteria in origin. So we can treat your chlamydia and your gonorrhea finally. But if it's viral, we can manage it. Unfortunately, most viral infections will manage it, just like HIV and hepatitis, you just manage it. But if we discover you have bacterial infection, if you follow the trend, we can completely take care of your gonorrhea, we can completely take care of your chlamydia, and we improve your fertility. Now, Obi, we have an event coming up on the 27th, and the event, it's a symposium for women. Now, can you tell our members the reason why they have to attend? Because we're going to look at lifestyle, we're going to look at love life, we're going to tie it to fertility, and it doesn't have any range. Any woman that is a woman needs to know more about her body. So what do you have to tell our community, especially people that are believing God to become mothers, in regards to this event coming up on the 27th? Please go ahead.
Yeah, so what I'm going to say is try to be there, because there have been a lot of testimonies that I've seen also from this group, from a lot of people that have been helped in so many ways.
2 days ago, we have a woman that I sent to Nigeria that had her baby at 50. She lives in New York.
Wow. Yeah. So you guys can see that there have been a lot of good testimonies, and just keep believing God is going to happen. What I tell people is that just keep doing your part. It's going to happen. It's going to happen for sure. It may not happen today, but it's going to happen tomorrow. Just come to this program and get insight and see practical ways. And you can also maybe hear from other people who have benefited and what they have done. That will also encourage you. So usually when we have some things here in America, we have a group session and all that. So this is kind of a group session that will help you on your way to fighting infertility. So I'm sure this is very important to you. So if something is very, very important to you, you're going to do everything possible to make sure you get it. So this program is going to be good for you. So make sure you're there.
Okay, so please, we are wrapping up. So please, I love babies. I'm a maternal and child health specialist, just like Obi is a cardiologist and interventional cardiologist. So I love babies. If I have my way, I'll have a community. But please, if you need help, get help. The earlier you get help, the better. Nobody is exempted from becoming a mother at any age. But the route you will take to becoming a mother might differ. A woman at 80 can still become a mother by going for adoption. A woman at 60 can still becoming a mother by going for adoption or going for surrogacy. So wherever you are, you will become. But how you become is what matters. But don't ever give up. But seek help. The earlier you seek help, the better. Thankfully, we have a platform to help you. Obi, we understand that Nigeria is very tough in regards to economy. So we've made our consultations to be easy in packages. Just like, when we were talking about package. So some women can afford to come in for 1 week, 1 month, 3 months, 6 months. Then if you're pregnant, we want to make sure that that pregnancy has good outcome, because there are so many things that can happen within 9 months. So we don't want to joke with anybody in this community. So if you need help, get help. Avoid your herbs. Avoid your anti-malaria. Obiora, you can relate to this. Our people treat malaria every 2 weeks by themselves. Avoid that. Avoid all those antibiotics you use in treating typhoid. Typhoid is a very, very severe disease. If you have it, we need to treat you appropriately. So the bottom line, be careful. Everything is going to be fine. Make sure you get the help you need. Follow admin. Don't let this be the only opportunity you have to flip. Make good use of this particular free masterclass. We could have paid a lot of money to have Obiora attend. You could have paid a lot of money to attend this, but we give freely because God gave us freely. So please, let's take our health very serious. So on Monday, when you go out for your Valentine's celebration, remember your heart. No matter how you're prompted to go and smoke, don't smoke. Remember, you can have two types of smoking: primary smoking and secondary smoking. If you hang around people that smoke, you're smoking. So be mindful. Watch what you eat. Watch your alcohol consumption. Sleep. Then ultimately practice your PPP. If you do all this, you're going to get there before you know it. Obi, I'm going to default. I know you nearly became a pastor before you went to university. So I'm going to allow you to say a closing prayer for our group. Then we can.
All right. In Jesus' name.
Amen.
Lord, we thank you for these wonderful deliberations. We thank you for your help as we had discussed everything that we needed to live a healthy lifestyle. Lord, at this point, I pray for every man or woman who's looking for the fruit of the womb. Lord, I pray that you're going to bless them this year in Jesus' name.
Amen.
Lord, we ask, oh God, Jehovah, that you direct them to doing the right thing and allow them to do that which they have to do on their own, while you do that which only you, God, will do. Father, in anyone that is looking for fruit of the womb, we ask, oh God, Jehovah, let that blessing from above visit them and their family now in Jesus' name.
Amen.
So we ask, oh God, Jehovah, King of Glory, bless every one of us who have come for this meeting, and bless every member of this group, that as we go on, Lord, we are going to be hearing more testimonies. We're going to be hearing how you keep blessing people. People are going to be saying about the goodness of the Lord and how this group has helped them in every way. Thank you, Lord, because we know you've answered our prayers. In Jesus' name we pray.
Amen. Amen. Thank you, Doc. And we'll see behind the camera. My regards to Mona and my little relatives. God bless you.
Thank you for having me.
In Young. We are going to arrest you again. Don't say no. It's not going to take long. But thank you so much for coming again. I truly appreciate it. Can we all appreciate Dr. Obi? Can we all give him a round of applause? And
thank you very much.
Bros, thank you for coming, and I'll see you when I see you. God bless you, and bye-bye.
Bye-bye. Bye-bye.
Bye now.